very soon. Now, something happened 2 days ago. A tragic incident happened at a hospital in Imo State. What happened was that there was there's a video online, I don't know if you have seen it, where a doctor was reported to watch a YouTube tutorial while performing a cesarean section. Now, the husband, whose name is Onyekachi Eze, he narrated the experience and he said he took his wife, who was in labor, to the hospital, where doctors informed him that she needed an emergency CS, what we call cesarean section, due to excessive bleeding. However, he was shocked when he witnessed the doctor and medical staff watching a YouTube video during the operation. What he said was, right in my presence, they were using their phones to watch a YouTube video on how to perform surgery. And he said, I lost my wife and my baby during the process. First of all, I want to say that may the soul of the departed rest in peace. Secondly, and very emphatically, no licensed medical doctor would open the YouTube video, watching a YouTube video, at the same time carrying out CS. No licensed medical doctor. I want to make bold to say, which also we have also seen online, that the people who carried out that surgery, they were quacks. Not quack doctor. There is nothing like quack doctor. They are quacks. Whether the doctors, the nurses, they are quacks. And it's sad that I don't know how this story will end. I don't know how this case will end. And I don't know if this case will also save another unsuspecting patient, because most times patients don't know. People don't know. And it's bad. I mean, very bad that there are so many of them outside in the streets. It's very, very, very bad. Some of them in the hospitals. They have no business in the hospital. Some of them are on the streets talking to you about health. Some of them are on social media. And now, we're in a generation where we all like this title. Oh, doctor. I'm a doctor. Oh, I'm a professor. I am a coach. You don't talk to me like that. And we can't even find out if truly this... Sorry, we are streaming live, Abby. Yeah, we are live. We are live. So, in case anybody has a comment, I think I'll take the comment. Okay, yeah, thank you very much. We are live on YouTube and Facebook. The YouTube is... What's the YouTube handle again? Nigeria Info FM. So, you can watch me live on YouTube, Nigeria Info FM. And I think I might take one or two comments from YouTube and maybe Facebook. I'm on Facebook too. So I might take comments on Facebook and YouTube as well. Now let me shock you. There was a publication from This Day newspaper a year ago. Now the title of the publication says The Proliferation of Quacks. Do you know that some years ago a fake medical doctor was discovered to have served in the Federal Ministry of Health for 9 years? Let that sink in. So wasn't the matter, the fake doctor rose to grade level 13 in the ministry and had worked in the Department of Hospital Services and Health Planning. Now, according to the permanent secretary, this was the publication in that ministry. The quack doctor secured his fraudulent employment by using stolen documents. It is so bad. Now, I'm saying this for so many reasons. Number one, I'm trying to call on all the regulatory bodies. I'm also calling on the Medical Association, the Nigerian Medical Association, Medical Dental and Council Association of Nigeria, the Nursing Association, and other medical associations. We should have a register that everybody can access. So if you call yourself, I am Dr. This, we should be able to go online and check and confirm truly if this person is a doctor or this person is a nurse or this person is a pharmacist. There are so many on social media. And now social media is the place where people learn. But at the same time, there are so many of them moving around in our environment and people don't know. You might fall victim tomorrow if nothing is done about this. If you want to send me a comment on WhatsApp. The WhatsApp number is 080 9597 5805. The WhatsApp number again is 080 9597 5805. So I think we should do something about this quickly. We need to have a register where if you say you are a medical professional, we should be able to confirm and yes now. Abi, it shouldn't be hard. Number two, I think we should have these routine inspections. It might not affect you. It might be somebody close to you, somebody you know, anybody. And see, this is a fear I have. I'm saying this on radio. I had a shocking experience also with regards to something like this week. I won't go in details because I don't have time for that. But if I have more time, I would share with you. I will keep some details coded or in secret so you understand what I'm talking about. I had a personal experience about this same stuff. People who don't even know anything about medication are prescribing medications for innocent Nigerians, and everybody, doctor. Now, whenever you hear the word, it is a doctor. Now social media we go agog. Doctors. That person is not a doctor. That person is not a doctor. Can never be a can never be because if you understand this pain, the suffering, what it means to handle human life, you can't do that. Now, I'm not saying that doctors don't make mistakes. God forbid. I'm not saying that mistakes. I'm serious. But what I'm saying is this particular case, this one that happened, this is not a medical doctor, is a quack. I want this person to get arrested. I want the man and his family to get justice, and I also want Nigerians to be safe. Now when you go online, when you go to Instagram, there are things you see. One page is talking about health. You go to the title, you see health on top of the page. Sometimes they even put doctor, MD. And I've seen a lot of white guys do this. White people, sometimes we Africans, the moment you see somebody who is a white talking about something, you want to look like this person is very correct. So I've seen a lot of white people do this. You see them put doctor in front of their name or MD, something. And because I spend time on YouTube, I listen to podcasts a lot. These guys know nothing medical about them. So I want to beg you, listening to me on radio, I want to beg you. It's difficult, but please, before you start taking anything from anybody concerning your health, investigate. I'm talking to you on radio. You can find out about me. This is not to brag. I'm not hidden. My name is everywhere. You can go to my institution and ask them, who is this boy? It's not something hidden now. You can confirm. So I feel sad that I'm scared, honestly. See, as I'm talking to you, my mind is beating fast because it can happen to anybody. Let's see. Hello, doctor. I think affordability might make people fall prey. Felix from Ijaye. Well, not about affordability, because whether you can afford or you can't afford, that is not the excuse. You don't know. What you don't know is bigger than you. You understand? So I'm saying this on radio. We need to have a regulatory, a register where you can confirm if truly this person is a doctor, is a nurse, is a pharmacist, is a physiotherapist, is anything, is a dietitian, is a nutritionist. For the fact there is doctor in front of somebody's name does not mean you should throw your critical thinking away. Now anybody can just call himself or herself doctor. They will travel somewhere, get one certificate, they come back. I am what? I am a doctor. You must address me. 08095975805. I want to take some comments on Robert. How do we know quack doctors? Can you prove to me if you are not one? Can I prove to you? If I prove to you, hope you will not say I'm bragging, right? You can Should I give you my folio number so you can go to the Medical and Dental Council of Nigeria with my folio number? It's called folio number, so that you get my full name, Dr. Frederick Unwigbohai. Graduated from the College of Medicine, Ambrose Ali University, Ekpoma, Edo State, Nigeria. You understand? So when I'm talking, most times, I'm talking with full confidence, also hiding under the grace of God, because this country, get us this, you know this country, right? Good. So you can go to the College of Medicine, Ambrose Ali University, Edo State, Nigeria, and tell them there's this guy on radio. His name is Dr. Frederick Unwigbohai. He did finish from your school. You understand, right? Yeah, you can do that. And I think you should also do that when you see anybody call himself or herself a doctor or a nurse or a dietitian online. We should be able to do that so that oh, sorry, I'm coming. Let me do this. Yeah. Okay, I'll be going on a very short break and I have a guest joining me. So how do you know? It's difficult to know, sincerely. It's very difficult. And this is why I'm speaking here on radio that the Medical and Dental Council of Nigeria should come up with a register where the public can just type somebody's name to confirm truly if you are indeed a medical doctor, or the Nursing Association should come up with a register where you can just go and type a name to find out if indeed this person is a registered nurse or a pharmacist. I think it's very, very important, so that I won't come here and keep repeating myself. You just go online and type, okay, it's true. Yeah, he is. Abi, what do you think about that? That would be the best decision to make, because we have a lot of them on the internet and people are falling prey. As a matter of fact, some of them are even sharing medications on social media. They come on the internet, they just tell you, if you have this problem, go and buy this medicine. And there are problems, you know. So I want to beg you once again. I had a personal experience 2 days ago. Was it 2 days? Yesterday? Yesterday or okay, 2 days ago. Yeah, I had a personal experience where somebody who has no business prescribing medication, let me tell you, combined diclofenac, combined indomethacin, combined aspirin. This person prescribed diclofenac, indomethacin, aspirin together for somebody that I know that is close to me. Please come in. And I felt very, very bad. Now, if you call them out, what they tell you is you want to spoil people's job. You want to spoil, and these people should not operate. That place should be closed. But if I call them out and the government goes after them, they will say this doctor wants to spoil people's job. But these people will soon kill somebody one day. So I'm using this opportunity, with the privilege that I have by the grace of God, to appeal to all well-meaning Nigerians to call on the medical associations that we need to have a register where we can confirm truly if this person is indeed who he or she say or who they say they are. That is what I think should be done, so that Nigerians will be aware. We'll be going on a short break. I have a guest joining me in the studio, and then when I come back, we'll be going into another discussion. Don't go anywhere. We'll be right back.
We report, you decide. Topical conversations that matter to you.
There are people for personal, religious, whatever reasons who do not want to take a vaccine. And I think they have the rights.
They cannot go to us to stop insecurity.
You're listening to the home of great talk and exciting conversations.
Many times, I think the word submission used in the context of marriage is very ambiguous.
When you eat groundnuts too much, you will get eye problems. Or when you drink garri too much, you get eye problems. It is true.
Just like you said, these are myths.
He said, women, speak life into your husbands, even when he's not acting right. And I almost threw my phone at him.
99.3 Nigeria Info.
.3 Nigeria Info. We are more than just radio. Subscribe to our YouTube channel at Nigeria Info FM. Check us out on Facebook at Nigeria Info 99.3. Follow us on Twitter at Nigeria Info FM and on Instagram at Nigeria Info FM Lagos for live updates as it happens. 99.3 Nigeria Info. Let's talk.